Now, heart disease is easily one of the most feared diseases. It's silent, it's hard to track, and there's so much conflicting information about how to protect yourself from it. However, after working with hundreds of clients to help them get all of their cardiovascular risk factors dialed in, I've created a system that I use to help my clients not only track the risk factors, but also get their risk factors into optimal ranges using diet, lifestyle, and supplementation. So in this video, in order to show you this system, I'm going to walk you through a case study of my client. We'll call him John. So I can show you the specific blood tests that I like to use to gauge cardiovascular disease, the dietary adjustments that I like to make to help my clients optimize their blood markers so that you can use those adjustments yourself, as well as some of the supplement strategies that I like to use to further optimize these blood markers. Now, before we get started, if you'd like to set up your own pro-metabolic diet, incorporating the very same principles that I'm going to mention here that I've used with my client John in this video, so that you can lower your lipid levels and you can dial in your inflammatory values and your insulin sensitivity, as well as protect your heart, I created a free guide for you to construct a pro-metabolic diet that helps you to do just this. The link's in the description. All right, to start, let's talk about John's starting place so we can see where he's coming from. Next, what we'll do is we'll talk about what his goals were, then what we did, and then where's his outcome now. So when I first met John, John was 53 years old. He was 160 pounds at about 12% body fat. So he had about 140 pounds of lean body mass. And he's a quite active guy. He was training 4 times a week in the gym. And he also had quite a physical job as a physical therapist. So he was working with patients all day long. Now, John's diet wasn't too bad overall, or typically understood healthy gluten-free diet. His total caloric intake was about 2,580 calories. The breakdown was about 30% protein, 20% carb, and 50% fat. So he had about 150 grams of carbs per day. This mainly came from things like sweet potatoes, buckwheat, and quinoa. Now, he had some fruits in there, but it's really like just some berries. And then he had some vegetables in there. He incorporated things like broccoli and asparagus and also spinach. Now, in terms of protein, his protein intake was super high. So he had about 180 grams of protein a day. This mainly came from chicken, beef, and eggs. And then he also had some fish. And he also had a very high fat intake. About 50% of his calories actually came from fat. And this is mainly through almond butter, peanut butter, olive oil, coconut oil, some dark chocolate. And then he had incorporated quite a bit of keto products into his diet, these different like keto fat bombs, keto breads, and stuff like this, which was also bumping up and contributing a significant portion towards his fat intake. Lastly, in terms of other dietary components, he didn't really have too much processed food. He had a small amount of processed food. And then in terms of alcohol consumption, he was having about 2 drinks a week, and they were mainly on the weekends, Friday and Saturday night. And he did have a couple drinks during the week, but this is something we'll talk about later that we had adjusted. Now, despite John's regular exercise and his relatively decent diet, he did still struggle with different symptoms. So some of the symptoms included IBS. So he had irritable bowel syndrome. He basically was having bloating, gas, loose stools. He wasn't really sure what was causing it. He just knew that sometimes it was bad, other times it wasn't. He also had years of high lipids. His cholesterol values on his labs, at least for, that he had seen, had always been high. There's some other markers we'll talk about that were also not ideal, but he didn't really focus on these because he was doing standard lab testing with his doctor. He also had generalized anxiety, and he was on medication for this. So he was on an SSRI, and he also had benzodiazepines as needed. And he also was having regular nagging injuries in the gym, particularly his biceps and his quads. He was having tendonitis, and he kept injuring the same places. Now, none of these things really pushed John to reach out to me. What pushed John to reach out and look for help was that he had gotten a CAC score because of his years of high cholesterol. And, he was thinking he exercises, he eats well. So his CAC score, was probably going to be 0. But he was surprised to find that his CAC score was 150, which was quite surprising to him, right? He's been taking care of himself pretty decently well. So why is he seeing this vascular calcification present? Why is he seeing this arterial plaque present? The CAC score is a marker of this for anybody who's not familiar with this test. And so basically what we did was we looked at John's lab work to try to understand what's going on and to try to see, where the problems were. And so when we went through his labs, John did have elevated cholesterol levels. His ApoB levels were in the 120s. He had a high oxidized LDL level in the 160s. His total cholesterol is in the 270s, LDL in the 180s. His lipoprotein little a, which is a genetic risk factor for cardiovascular disease, this actually wasn't elevated, which was good. His small, dense LDL particles weren't elevated either. His HDL was actually on the higher side in the 70s. Alcohol could potentially contribute to some of that. His VLDL levels were okay, and his triglycerides were okay. So the big problems with his lipids, but his ApoB was a bit on the higher end, and his oxidized LDL as well as his total cholesterol was a bit on the higher end. Now, later on, we followed up down the line with an NMR lipid panel so we can see the LDLP, the particle counts, and we followed up on his ApoA1 values. But we don't have a baseline. These were the initial labs that he had before we started working together that we were running with. Now, the next thing is he had insulin resistance. So his hemoglobin A1C was about 6.1%. Not ideal. We really want this less than 5.4%. His fasting blood glucose was in the low 100s, although his insulin value was okay at 4 micro IU per milliliter. So his insulin levels were fine, but his fasting blood glucose and A1C values were bumping up. Part of this could have been related to his very high protein intake, lower carb intake in the exercise, pushing up gluconeogenesis, and then potentially impacting the A1C value. So his blood glucose is staying high all the time. Overnight, his blood glucoses were staying high on average, so that was having this high fasting value. And this could have adjusted his hemoglobin A1C values on top of the bumps with meals from some of the starchy carbs. Now, he also had some micronutrient imbalances. So his RBC magnesium values were less than 5. His zinc status was in the 40 micrograms per deciliter. His copper was in the 40 micrograms per deciliter. His ferritin values were quite high. He was in the 300s. And his homocysteine wasn't too far off, but it wasn't ideal in that 5 to 7 range. It was at 10. He had normal but slightly lower B12 and folate levels. So he had some micronutrient deficiencies in conjunction with a little bit of insulin resistance and then the dyslipidemia, the altered lipids. Now, he also had thyroid dysfunction, and this was something new to him when we first started working together. His TSH values were in the mid 4s. We really want them around 2 or less. So quite a bit on the upper side, at least for ideal targets. His free T3 value was also low, it was in the low 2s, and his free T4 was below 1. Now, his reverse T3 was actually fine, but the rest of his thyroid values weren't so hot. And his reverse T3 could also have been on the lower side because his actual total thyroid hormone values were on the lower side. His testosterone levels were also a little bit borderline. On the low end, testosterone in the 300s. Really want to see that around 700 to 1100. And his free testosterone value was in the 60s. So both these values not so great overall. Still in normal range, but not an optimal range. And then he had some mild adrenal dysfunction going on. So his cortisol wasn't high, but his DHEAS was on the lower end. So his DHEAS was in the low 100s and his cortisol was around 10. The ratio between them was good, but the absolute DHEAS values weren't ideal. Now, the goals that John and I had established together to dial things in, we wanted to halt and potentially reverse the plaque development of his arteries. We wanted to optimize his blood cholesterol levels. We wanted to eliminate his digestive symptoms, so the bloating, the gas, loose stools, or at least figure out what was driving those. The goal was to try to minimize the benzodiazepine usage and then potentially in the future wean off the SSRI with the help of his doctor. We also want to get his insulin sensitivity values in a much better spot. The 6.1 A1C wasn't perfect, so we were shooting for the 5.4. We wanted his fasting glucose levels less than 90. We wanted to keep his insulin where it was at because it was pretty good. Now, we also were looking to replete his micronutrients, right? We want to make sure that he had adequate iodine status for the thyroid. His zinc, his copper, his iron values were all dialed in. His homocysteine value came down, and his B12 and his folate levels were dialed in. We also wanted the thyroid function to be in a good spot. So we wanted to get his TSH around 2 or less. We're looking to get his free T3 between 3.2 or 3 to 4. We wanted to get his free T4 value between 1.3, 1.7. And we wanted to keep the reverse T3 value as we improved his thyroid function less than that 16 mark. We also wanted to see his testosterone go between the 700 to 1100. We wanted to see his DHEAS levels pick up. So ideally, at least we wanted to see them at least greater than 200, if not greater than 300. We wanted to keep his cortisol in a good spot between the 10 to 14, when we wanted to keep his ratio of DHEAS to cortisol greater than 10 to 1. Now, the last one here is we wanted to eliminate John's nagging injuries. So no more quad tendonitis, no more bicep tendonitis. The goal is to make sure that he can continue to exercise without having to put up with these chronic inconsistent injuries. All right, so with John's context and goals lined up, the next thing is, what did John and I do to get these things under control? So this is where the process comes in, and this is the step-by-step process that I'm typically working through the client. Now, the individual steps are different per person because people have different problems. Not everybody has a thyroid problem. Not everybody has insulin resistance. Not everybody is dealing with these specific micronutrient deficiencies. So it's really important to hone in on what the individual's problems are and then systematically, step by step, clear out those problems. But what I typically do is I start at the foundation, at the base, at the pyramid, make sure the diet is dialed in effectively, make sure the micronutrient status is dialed in effectively, the lifestyle components, sleep, and the exercise and movement routine and stress are dialed in appropriately, and then start to work on the more specific high level problems like thyroid issues, like adrenal dysfunction. If they're dealing with gut dysfunction, stuff like this, start to get those things under control and target those directly once the foundational pieces are under control. So the body is in a much better state overall. So you can start to overcome some of these other problems. So for John, the first step, and this is usually the first step that I'm doing with most people I work with, is I'm dialing in the diet. And so what we did was we increased John's caloric intake because he was actually on the lower end. We wanted him to be closer to 2,800 calories per day so that he could recover from his training. We could help to support his thyroid function, and we could see if bringing adequate caloric intake, specifically by increasing carbohydrates, we'd be able to help lower his anxiety and help to improve his sleep overall. The other thing did was we decreased his protein intake. At 160 pounds, there is no need to be at 180 grams of protein per day. Way too high. So we brought him down between the 0.64 to 0.82 grams per pound per day, which wound up being about 130 grams of protein per day. This was so that he didn't have to keep pushing excess gluconeogenesis from this very high protein intake. And also, we don't need to take in protein at really high levels because we're just going to convert it to carbohydrate. So we want to just have the carbs instead. So we filled in the difference with carbohydrates. And then also, one of the hypotheses that we were running with is that the very high protein intake he was having was potentially putting pressure on his GI tract. So we wanted to bring the protein down to take pressure off the GI tract. The next thing we did, which just may seem interesting to people in the low carb community, is that we increased his carbohydrate intake to about 350 grams per day. This was to help improve his insulin sensitivity, to help shift his lipid profile, because having a bit more carbohydrate can help shift that lipid profile, especially metabolic function is working well. We wanted to support his thyroid function. We wanted to make sure he could effectively recover from his training because he keeps getting these nagging injuries. We needed to replace the calories from the protein with something, so better to replace it with carbohydrates. We also brought his fat intake down because his fat intake was quite high at about 140 grams per day. This allowed us to add more room for those carbohydrates, again, help us shift his lipid profile. And then this also allowed us to make more room in his diet for nutrient dense foods instead of adding these added oils and these keto based foods that have a bunch of calories and a lot of fat, but don't really provide much micronutrients, some of the fibrous components to help shift the microbiome, and some of the polyphenol compounds. The other thing we did is we shifted his fat sources so that he was mainly monounsaturated fats with less polyunsaturated fats. The way we did this is we nixed the almonds and the peanuts and we replaced with macadamia nuts and macadamia nut butter. We increased his avocado intake, his dark chocolate intake, and we kept going with his high quality extra virgin olive oil. We also switched his cooking fat from like a lower quality olive oil to a good quality coconut oil so that he didn't have a lot of oxidized lipids going into the system from the cooking process. We also made some adjustments in some of his supplementation, and we'll talk about this, to help decrease the oxidized LDL particle in his blood and also lower ApoB, LDL, and total cholesterol. The other thing we did with diet is we shifted his food sources so we can help minimize his digestive issues. So we eliminated the higher FODMAP foods like the asparagus, the broccoli, the sweet potatoes, and the buckwheat. We replaced them with white potatoes, with oats. We added in some more fruits. We added in some rice, and we also added in some vegetable sources that weren't high in FODMAP. So some carrots, some squashes, some of these components, so that he would have easily digestible fiber sources and easily digestible carbohydrate sources, so he's not so bloated and gassy. And we also tested these foods out to make sure that these were the specific problematic foods and that these were the foods that he tolerated. The last piece with the diet that we did is we adjusted his alcohol consumption. So we basically just made a rule only on the weekends. The alcohol is not really great overall, so the goal is to kind of minimize it. But at the same time, like having a glass of wine with your wife on Friday night and Saturday night, I don't think it's that big of a deal. You got to enjoy your life as well. So we shifted it so that he does it mainly on Friday and Saturday when he's spending time with his family so that he can try to relax. And we also made sure that when he's having his wine, he's having it with a good quality meal that has a decent amount of fiber, a decent amount of protein, a decent amount of monounsaturated and saturated fat intake, and some fruit polyphenols present at the same time so that he can protect his liver, his intestine, and his microbiome from the effects of the alcohol. Now, once we made these dietary adjustments, the next thing we did is we went to the next stage in this pyramid, which are going to be the vitamin and the mineral adjustments. So we made sure to bump up his zinc and his copper status. We wanted to see his zinc and his copper levels in his blood around 100 micrograms per deciliter. The hypothesis here is that this would help to support his thyroid function. It would help to support his testosterone levels, his insulin sensitivity, bolster his antioxidant status by making sure the antioxidant enzymes have all the cofactors they need, and help to shift his lipid panel, because low levels of some of these micronutrients can have an impact on lipid metabolism. The next thing we did was we wanted to unload some of John's iron, because his ferritin values were quite high. The other serum iron value, the serum iron, the total iron binding capacity, and his iron saturation values, they were okay, but his iron storage and ferritin was quite high. So we wanted to take some of that off. We also put a B complex on board because he did share some genetic data with me. He did have some MTHFR mutations. He did have the homocysteine wasn't terrible, but we wanted to get an ideal range since we had this cardiovascular risk, and homocysteine is known to damage the vasculature. So we dialed in his active B12, his methyl B12, and his methylfolate intake to make sure homocysteine's down, and he had all the B vitamins he needed to function and process the carbohydrates that we were going to bring on board appropriately. After this, we added a very small amount of an organic, high-quality seaweed, so we can get his iodine intake roughly around 200 micrograms per day. We didn't know if he was iodine deficient or not, but since thyroid was a little wonky, we wanted to make sure there was enough iodine there so his body had what it needed, but not too much where you start to induce something like the Wolff-Chaikoff effect, where the body starts to shut down the import of iodine to the thyroid gland and lead to worsening of hypothyroidism. So we want to make sure it was balanced, not too much, not too little. Now, once his micros were dialed in, his diet was dialed in, the next big piece we looked at was his workouts. His workout activity, his exercise volume was exceptionally high. At some weeks, he was doing like 20 sets per muscle group per week, which is crazy. So what we did, at least by my standards, right? Maybe somebody else thinks differently, but what I did was I brought his exercise volume to about 8 sets per muscle group per week, and then he could increase the number of sets per muscle group per week for specific muscle groups that he wanted to bump up. And we found 8 because that was where he was able to recover effectively. He didn't have to deload so often, where he takes a week to take some of the pressure from the exercise off. And also, he was able to not have as much injuries. His injuries kind of calmed down a bit. The next thing we did was we also shifted his exercises around, because John was doing quite a bit of exercise that had a lot of axial loading. So he was putting heavy weights on his spine, front squats, back squats, deadlifts, Romanian deadlifts, these types of things. Now, we still kept those things in, but we shifted the volume around so that he would do some front squats, and then he would do some Bulgarian split squats, and then some leg extensions, so that he was distributing the loading on the muscles across these different exercises. So he didn't have so much heavy axial loading, which was tiring him out. I think was potentially driving some of the injuries that he was experiencing. So he just distributed a bit, but within that volume. And this was also helped John to recover better, as well as minimize his injuries over the long term. And he was still progressing. He was still getting stronger. He was just less worn out overall. Now, once we shifted his workout volume, we then started to get into specifics now. This is where we're going to talk about thyroid, vascular health, DHEAS, testosterone, his anxiety, his injury recovery. So with this, the next big piece that was out of whack after these foundational components was really the thyroid function. This is actually pivotal to get this under control, because thyroid function is directly involved in cardiovascular health. So between John, myself, and his integrative MD, what we looked to do was bring some NDT on board, some natural desiccated thyroid, to help to optimize his thyroid function. So his integrative doctor had given him a prescription for a natural desiccated thyroid. This helped to increase his body temperature, which was previously in the low 97s. Now he's up around 98. It also helped to shift his values, so we got this into optimal range. We'll talk about that. The goal was to help to use this to lower his LDL cholesterol as well as total cholesterol, because thyroid controls the LDL receptor as well as the metabolism of lipids at the liver. The thyroid is also protective of the vasculature. And then on top of this, the thyroid can help to improve John's insulin sensitivity, especially if thyroid function is low, and you bring it back up to normal, up to a euthyroid status. So we did that. We were hoping the thyroid would do all of this, and we'll talk about what changed with the labs in the next section here. Now, after thyroid function, we then started to directly target vascular health. And from here, we started to bring on adequate vitamin C, vitamin E, and olive leaf extract. This, in conjunction with the dietary changes, was put in place to help minimize the oxidized LDL cholesterol. We also brought on certain herbal components. So gotu kola, pycnogenol, and pomegranate extract. This was to help to protect the endothelial cells in his vasculature, as well as to minimize the plaque formation, help to potentially regress some of the plaque formation, minimize some of the vascular calcification. The other thing we did Further, to help protect against the vascular calcification, so we brought on high dose vitamin K2 MK4, as well as K2 MK7, and an optimized vitamin D3, vitamin A, calcium, and magnesium intake, so we could keep the parathyroid hormone levels down. So we're not pulling calcium from the bone and then potentially increasing the vascular calcification. We also, with his integrative doctors, okay, with a blessing, he brought on a low dose aspirin, 81 milligram aspirin, to further protect his arterial function over time and minimize some of the excess clotting that's involved in the atherosclerotic process. So these were all directly targeted for vascular health for multiple areas: the LDL oxidation or oxidative stress, the plaque formation, endothelial dysfunction, the vascular calcification, and then also the excessive clotting process that happens in cardiovascular disease. Now, once the vascular stuff was organized, we then moved to adrenal function. We brought a little bit of DHEA on board. This was to help increase his DHEA level, to make sure that he was at an adequate level and balanced out with the cortisol levels that he had, so that he didn't really have a very low DHES to cortisol ratio. So we wound up settling on was about 10 milligrams of DHEA 2 times per day. This improved his level without giving him negative symptoms like agitation or acne or something like this. We also brought in a little bit of pregnenolone to support the DHEA that he's bringing on board. We were hoping that some of the DHEA and pregnenolone, in conjunction with the other adjustments to thyroid, the micronutrients, could help to bump up his testosterone values. And it actually did. So within the first couple months, he went from the 300s into the 500s, with making these adjustments alone, the diet and some of the supplementation. Now we're looking to see if he goes all the way to 700, which would be ideal. So we're going to follow up on these labs next and see where he's at. From there, we dial the last 2 things that we wanted to dial in. These were not primary focuses as much as the other components were, but they were more ancillary things. We wanted to make sure his anxiety was under control and he had solutions so that he wasn't having to rely so much on the benzodiazepines, because they're not very good medications and have some pretty negative side effects long term. So what we did was we brought in a stack of L-theanine, glycine, and taurine. These have beneficial effects like glycine and taurine on the liver, on cardiovascular function. They can also help to have a relaxing effect, a calming effect, without being addictive. So we brought these on board in appropriate dosing so we can use them as needed to help minimize his anxiety, in conjunction with the carbohydrate adjustment and everything else, and adjusting his workout volume. We also, while we were making adjustments with the diet and slowly titrating up the carbs because he's coming from a lower intake, we use these in the meantime more so. However, now he hasn't had to use it quite as much. They haven't been as required because he's been feeling much better overall just with the dietary adjustment. So he doesn't have to dose them as much. But in the beginning, he was dosing like 2 to 3 times a day to help to keep some of the anxiety down, and especially dosing it before bed. The last one's the injury recovery. So we use some red light therapy in the 600 to 800 nanometer ranges, as well as a little bit of topical DMSO, as well as pregnenolone and DHEA, to help John recover from some of the tendonitis. So we put that on topically to help minimize inflammation in some of his joints and tendons, particularly the bicep and the quads, which is where he's having most of the symptoms, most of the pain and the discomfort. All of this dialing in everything and tweaking and making adjustments took us about 6 months. A lot of the changes that we saw happened before 6 months, but at right now, it's as of 6 months, we've gotten all of these areas under control. We're going to run this for a period of time and then follow up on some of his values to see where everything is. But in the meantime, we do have some interim values. So in probably another 6 months or so, we're going to have John follow up on a CAC score to see if it's at least stabilized. That's a good marker to make sure that the CAC value has stabilized. We've also put a system in place so we can track the progression over time. So we're going to look at carotid intimal medial thickness tests, and we have regular lab analysis looking at an NMR lipid panel, ApoB, ApoA1, the inflammatory values, HSCRP, his thyroid functions, insulin sensitivity, etc. So we can see if everything's holding in a good spot and his risk values are very low. We also, as of this point, his ApoB is now in the 80s. So it's decreased significantly. The initial value that he was dealing with when we first started, he had his ApoB in the 120s. So we had about a 40 milligram per deciliter drop in his ApoB from the dietary adjustments and from some of the supplementation. This is without any medication besides a little bit of aspirin and the thyroid support. His total cholesterol is now in the low 200s. This is a drop from the 270s, so about a 70-point drop in his overall cholesterol levels. His LDL is now in the 120s, and his oxidized LDL is in the 40s. So his initial LDL value is in the 180s, so about a 60-point drop there. And then the oxidized LDL value was in the 160s. So we cut the oxidized LDL values to 25% of what they were. in the beginning, and now it's through the supplementation, some of the dietary components. Now, as far as digestion goes, he doesn't have any more bloating. He doesn't have any more loose stools. He still does get occasional gas, and it's dependent upon the foods. Like if he has sweet potatoes again or broccoli, he still gets a little bit of gas from those. But otherwise, it's drastically minimized. No more significant digestive issues or anything like this. In terms of anxiety, John hasn't had to take a benzodiazepine in 3 months. So he's still on SSRI, but no benzos, just been with the diet. And we haven't really used, as far as he reports, the glycine, taurine, L-theanine, because he's doing well otherwise. He is considering now at this point, with the support of his MD, to try to taper off the SSRI, but he hasn't made any decisions. We haven't done anything with that yet. That's up to him. In terms of insulin sensitivity, so he was at 6.1% on his A1C. Now he's at 5.7%, despite increasing his carbohydrates. Now his fasting glucose was in the low 100s before. Now we have it in the 90s. His insulin is still less than 5. I think it went up a little bit. It was like 4.7 from 4.4. And then when we did the NMR lipid panel, his LPIR score, his lipoprotein insulin resistance score, was less than 25, which is ideal. Now, micronutrient status, we brought his zinc into the 90s. We're going to go a little bit more just to give him a buffer, so get to the low 100s. His copper's in the 120s, so it's pretty good now. And then we were waiting to see his updated iron panels because he waited a little bit to do a blood donation to bring some of the values down. So we just did the blood donation recently, and we're going to follow up and see where ferritin values and lipids are. But it takes a little bit of time. You don't want to do it right after blood donation because the values can actually be shifted. His thyroid function is now normalized. Obviously, we used thyroid support there with the naturally desiccated thyroid. The TSH is now less than 2. His free T3 is still coming up. We have him in the high 2s. Ideally, I want him over 3. And then his free T4 is now over 1. Before it was less than 1. So he's still coming up. But overall, he feels a lot better. With the thyroid on board, his recovery had improved. And obviously, we see changes in these lipid values. His testosterone, now this changed pretty fast with some of these adjustments. So 3 months in, it was in the 500s. We don't have a follow-up yet. I'm still waiting on that. But ideally, we want to see it between 700 to 1100. So he was in the mid 300s, then he went to the low mid 500s. So it was just under a 200-point bump with these adjustments. His cortisol is hanging out around 10, and his DHEA to cortisol ratio is now greater than 20 to 1 because we brought his DHEA levels greater than the 200s. So essentially, his DHEA bumped up. The cortisol DHEA ratio looks pretty good overall. In terms of injuries, so his quad tendonitis and his bicep tendonitis haven't been a problem for over 2 months. Initially, the DMSO plus DHEA and pregnenolone were able to help minimize some of the pain and discomfort that he was dealing with. But dialing in thyroid actually seemed to have made the most difference anecdotally from our conversations in terms of adjusting the discomfort he was having with his joints. And the last one, this isn't something that we were tracking. It wasn't like a primary goal, but John's weight has been relatively stable throughout the whole process, despite increasing his total caloric intake. Again, within reason, right? We didn't bring him up to 3,000. Based on his activity level, around 2,800 calories per day was a good target. So we have about 2,800 calories. And then we did increase his carbohydrate intake considerably up to 350. He was at 150. So a 200 gram per day carbohydrate bump. And he's actually down 2 pounds now, about 158 pounds. So overall, in a great spot, pretty stable with his weight. Dialed in his cardiovascular health, dialed in his thyroid function, his micronutrients, his insulin sensitivity is improving. We just got to get the insulin sensitivity fully dialed in and follow up on some of these vascular labs. And then we can see where John is able to be at. And the nice thing is once everything's dialed in, we've built out a new lifestyle for him. So it's not like he has to maintain this like super rigorous thing. Is basically adjustments to what he was already doing. We add in some supplementation. Once the values are dialed in, we'll pull some of that supplementation off. And then he just maintains the diet, the exercise, and then some of the core steps going forward to make sure that his risk factors stay in. And we just keep making sure that the CAC score, CIMT values look good. So now that I've shown you this step-by-step process that I work through to rebuild my client's cardiovascular health, what you see in here with John, you'll need to know how to actually start this process for yourself. And as you saw in this video, the first step that I typically take with this process is to dial in your diet. So what I'd recommend is that you watch this next video here, where I'll show you how to build out your diet so you can get started in recovering your own cardiovascular health, just like John has.